nag-miss ako.
Hi, Doc! Good morning! Hi, guys! I wanted to meet Dr. Tan Shosho.
Thank you.
Si Dr. Tan ay isang neurologist. Study of the brain. Kasi pag-usapan natin ang sakit na Alzheimer's. Alzheimer's disease. Na balita ko nga sa Amerika, Doc, maraming nawawala ng buhay dahil sa sakit na yan. Let's go ahead and sit. Sit there, Doc.
Yeah.
Dr. Tan, medyo na-traffic ka yata. Kamusta naman?
Okay naman.
Welcome sa Good Morning, Kuya. Okay, pag-usapan natin, Doctor, yung Alzheimer's. Kasi we've heard na a lot ng maraming mga famous na mga artista and even models and all that nagkakaroon ng itong sakit na ito. What is Alzheimer's, Doc?
Well, Alzheimer's disease is a disease of the old people, you know? And the main problem is the memory and the cognitive dysfunction. What I mean by cognitive means understanding, comprehension sa mga daily activities. Okay? And aside from this memory and cognitive dysfunction, pati behavior nila nag-iba. Okay? They become...
Nagiging irate sila di ba?
Yes,
because they cannot
suspicious,
remember.
Nagkakaroon ng depression, mood swings, and all that confusion. Doc, we have a picture of a brain dito sa ating screen, Doctor. And pinapakita yung healthy brain. Kasi may sinasabi sila, Doc, na yun daw mas maraming ridges, mas matatalino. Tama ba yun? Totoo ba yun, Doc? And
as you can see, can I stand?
Go ahead and stand, Doc.
Can you stand up? This is normal brain, normal brain structure, Okay, these are full of brain tissue, okay? Brain tissue, And on the other hand, itong part naman, ang daming, like this is smaller, okay? This is smaller. Nag-shrink, At maraming mga empty spaces.
Marami ng empty spaces.
So, nabawasan yung brain cells and brain tissue.
Doc, pag may Alzheimer's, anong part po ng brain ang may problema? Di ba? Part ng may learning, may thinking.
Oh, yeah. Actually, the brain is meron the outer is we have the gray matter and the white matter, And this usually the frontal and temporal lobe are affected.
Doc, you've mentioned na isa tong sakit ng mga matatanda. Usually po, Doc, anong age nagkakaroon ng ganitong...
Usually around the age of 60 and above,
So pag 60, dapat maghanap na ng...
Be careful,
Malapit na si Lindon.
But usually, pero yung mga iba, by the age of 60, 70 is still very okay, Now, one thing I like to emphasize, yung bang Alzheimer's is not really necessarily a disease of the... I mean, not necessarily porque matanda na makakaroon ng Alzheimer's. Okay?
Oo, may napanood na ako, Doc, na pelikula. Bata pa lang siya, mga nasa 40 years old na siya.
That's an exception.
She used to be a very good writer. Tapos, nagsimula siyang mag-lose ng memories niya. Yun ba ang isa sa mga simptomas, Doc, na...
Yun is another type of... kasi, actually, ang Alzheimer... Ang ulyani, we call it ulyani sa Tagalog, is, we call it dementia, Dementia. Now, sa under dementia, maraming category. Alzheimer's is one, which is most common. Meron din tayong tinatawag na frontotemporal dementia, or we call it PICS, So, these are other types of dementia.
Doc, isa-isahin po natin, explain po natin yung mga signs and symptoms ng isang taong nagkakaroon na po ng Alzheimer's.
Yeah. Siguro, we can say that usually the first symptom is the memory loss. Okay? The memory loss. Ang memory loss ng mga elderly usually, they are the so-called, they call it recent memory. Okay? What we mean by recent memory is the memory just kaagad-agad lang. Let's say, sabihin niyo sa kanila, let's say, we'll go to Luneta. Okay? So, this is a new information, Luneta, So, after maybe few minutes, saan tayo
Nasaan
pupunta?
tayo?
So, we'd say, Luneta na naman. And then, paulit-ulit, So, for us, we always say, nagiging makulit, Actually, it's not makulit because they don't know. They forget, I forget, so of course, I have to ask. So, ang complaint ng family is, nagiging makulit, So, they even forget what they ate kanina.
Yeah.
Some of them,
I've
they even
experienced
forget na kumain na sila. So, hingi uli ng pagkain.
So kasama ba yan yung pagkawala ng mga susi, nilalagay yung sinelas sa ref, yung may mga gano'n?
Yun
Parang
na.
nagkakaroon na sila ng confusion on what to do.
Yun, sa chinelas sa ref, ano.
Oo.
And one thing is that, as I said, it's recent memory, ano. So, ang nawawala is the recent memory. Pero ang long-term memory, still now retained. So, they can still remember things dated back 20
Nung mga
years
bata
ago.
pa sila,
Yes.
yung experiences.
So, kaya yung mga iba natataka, bakit naman? Mga old memories, natatandaan pa nila, but recent one.
Pero I was wondering, Doc, bakit may mga bata din na makakalimutin?
Yeah, the
Diba?
young
May mga
ones,
young ones na
Well, the
makakalimutan.
young ones, I think, yun pagka malimutin nila, hindi na, it's more of poor attention, most of the cases. Poor attention, okay? Or, minsan, mga bata, di ba?
Oo.
And also, those people who are very busy, okay? So busy to the point that they forget,
Yung details.
unlike kasi tsaka, those people who are very busy, no? They can recall. Unlike in Alzheimer's, kahit nabigyan natin ng tips,
Wala.
they cannot recall the events.
And is there no explanation why this happened? Alzheimer's in older people?
Now,
Or why is it triggered suddenly?
No, actually, it's that the Alzheimer's is a slow process.
Okay.
Yeah, usually it's at biglaan, It's a slow process. Now, what are the causes? Number one is we have something which we call acetylcholine, a chemical substance which we call neurotransmitters, So we need this transmitter for us to maintain our memory. Okay. And also, may mga abnormal substance, the abnormal protein like Lewy body, the tau protein. Itong mga abnormal substances, they interfere with the transmission kasi ang brain activity,
Yes.
we need the transmission of connection of the nerves, So this will intervene.
So, pwede bang mamana yung pagkakaroon ng Alzheimer's?
There's a
Can it
small,
run in the
a very,
family?
very small percentage of
Percentage.
chances. Okay.
Tanong ko din, no, sorry Doc, no, pardon for the ignorance. Tatanong ko
No,
lang
no.
din, dun sa yung mga taong nag-undergo ng mga surgery, ganyan, tapos nalagyan sila ng epidural, ganyan. Meron din ba silang chance na pagtanda nila magkakaroon din sila ng Alzheimer's? Would that connect somehow?
Mga head trauma, mga...
Yeah,
with head trauma, nagkakaroon na higher chance.
Higher chance.
Chance of...
Ano naman po yung mga pwedeng gawin exercise? Kasi if I can remember my lola before, although she suffered dementia also before siya namatay, mahilig siya mag-crossword puzzle. Pero sabi nga nung doctor, okay daw yun na maging exercise ng brain. Ano pa po yung, tama po ba yan? And what else can someone do para ma-exercise yung brain nila? Hindi sila
that's a
magkaroon
good,
ng...
very good point, Actually, studies show that people with higher educational attainment, the chances of developing dementia is much lesser.
Is lesser.
That's why we need both physical and mental exercise. By mental exercise, like cross-stitch, crossword puzzles, reading Bible, playing cards, even music therapy.
Really helps.
Kasi music therapy helps, Saka it's also a kind of mental exercise. And then talking about physical exercise, studies show that physical exercise will prevent. Okay?
Wow.
May study na kasi the brain tissue medyo natitiken.
Doc, may mga studies kasi na marami na ngang namamatay dahil sa sakit na Alzheimer's. The question is, ano ang possible complications niya na it has something to do with the brain but affects the whole entire system as well?
Well, usually patients, they don't die of dementia or Alzheimer's. They die of the complications. Katulad at the latter stage of the dementia, na parang the learning is so poor na they don't even know how to eat.
Yeah.
They don't even know how to take care of their personal hygiene. And eventually, bedridden, then nakaroon ng bed
Bed
sores,
sores.
poor nutrition, yun iba, nakaroon ng fall, then fracture, hitting the head. Okay? So fracture, accidents, poor nutrition, and then pneumonia. And all of this may cause death.
So, pwede bang magamot siya if earlier detected, Doc?
Earlier detected, it helps. Ano? Siyempre, may mga gamot ngayon that can slow down.
Slow down the process.
We cannot totally stop the progression or deterioration of the disease, ano? But it will slow down.
Ano
And
naman-
proper nutritional care, ano?
Yeah.
Supportive care.
Yes.
Yun nga, I was
Accident
gonna ask nga po,
prevention.
Doc, ano po yung mga tips or advice that you can give for the family na meron po silang family member na merong Alzheimer's disease. Is it also practical na ilagay na lang sila sa home
care.
for the aged, yung na meron pong nagsispecialize for Alzheimer's
Yeah, this is a
disease?
very good point and a very practical point. And usually, a dementia is not the problem only of the patient. It's a family affair.
Yes.
It's a family affair.
So the whole family is involved, ano? And in practical setting, most of the family members are working. Okay? And then, iniwan lang nila sa yaya, no? And if maswerte sila if there's a good yaya.
Yes.
But at times,
Masungit.
they don't care, no?
Oo, tsaka minsan nakakalose din ang patients if you don't get to understand
Yes.
ano yung pinagdadaanan ng matanda. Kasi nagiging masungit din sila,
Yes.
nagiging moody sila, nagiging magagalit
Yes,
din
yes.
sila. So, kailangan ba, Doc, pagka may ganyang mga sakit yung aalagaan nila, nurses ang magyaya sa kanila or something like that? Yung may alam
Well,
tungkol sa
nurses
sakit
will
na
be a
yun.
good choice, ano? Of course, but what is important is the care and concern, not necessarily nurses, ano? And then dapat may mga activity like watching TV, as I said, walking, ano, para ma-maintain ang mental and physical exercise nila.
Is there a way that they can do na hindi po siya ma-prevent yung progress nung pagkakaroon niya ng Alzheimer's, Doc?
To prevent.
Opo. Meron pa bang pwedeng magawang ganun?
Well, before let's say during I would say that the prevention of dementia, we can say even starts at young age.
Okay.
Young age, ano? Kasi if we have young age, good physical, mental exercise, na-preserve and even na-enhance ang brain function. So, it should start at the age of, let's say, 20 or even 30 or even, okay? And another thing is that diabetes, okay? Control of diabetes, hypertension, okay? Ano pa? Stroke prevention kasi people with stroke, they are more
Yes.
predisposed.
Okay.
So
Well,
proper diet.
yeah. Thank you so much, Dr. Tancho Chong. Makakasama po natin siya sa ating medical mission this coming Sunday.
Yes,
At
Sunday.
maraming mga doctors na kasama kasi si Dr. Tan na lagi nating nakakasama sa mga medical missions. Nagpapa-hello sa'yo si Miss Elisa Palomino.
Oh, yes, si
Ayan, who's
Elisa,
watching
yeah.
right now.
Oh,
Thanks
yes, Elisa.
again. And
Okay.
they can see you sa hospital, doctor, sa Metropolitan ka pa rin ba
Medical
connected?
Center, yes.
Well, thank you.
Thank you.
Thank you, Doc.
Thank you.